So what if I told you there was a single culprit, really hiding in plain sight, that was responsible for so many of our chronic issues?
You mean like high blood pressure, brain fog, that kind of thing?
Exactly. High blood pressure, not being able to lose weight, crippling brain fog, and even really serious things like Alzheimer's and Parkinson's.
Right. And that is the startling central idea we're doing a deep dive into today. It comes from Dr. Annette Bosworth.
She's an internist, right? With a lot of experience.
25 years of it. And her conclusion from all that clinical experience is that chronic excess insulin is the silent, pervasive root cause of, most of the decline we see today.
And that's our mission today for you, the listener.
Yeah.
We really want to understand that specific mechanism. It's not just about blood sugar.
No, it goes much deeper.
It's about grasping how your body stores energy and why getting into what's called a ketogenic state is so important for reversing this high insulin state.
It's a really powerful way to look at it because it shifts the whole focus. You stop treating individual symptoms.
The joint pain, the depression.
Exactly. And instead, you start addressing the one underlying physiological driver. She argues that we could completely abort this trajectory of chronic decline if we just knew how to routinely make ketones.
Okay, so let's unpack that. This core hormone, insulin, we hear about it all the time. But in simple terms, what is insulin? And how does too much of it become such a chronic disease maker?
Well, the name itself is a great clue. Insulin insulates.
Insulates.
It's a storage hormone. Its first job, its most important job, is to take glucose sugar out of your bloodstream and get it into your cells for energy.
But what happens when those cells are full?
That's the key. When the storage is full, insulin directs all that excess energy into long-term storage. And that's fat. It literally makes you more fluffy, more insulated.
Okay, that explains the weight gain. That makes perfect sense. But how does a storage hormone cause something like, say, brain fog or high blood pressure?
So the trouble really starts when your pancreas is just constantly stressed, constantly pumping out high levels of insulin, usually in response to eating carbs all the time.
And when insulin is always high, that sends a signal.
A signal of energy abundance. And when the body thinks there's an abundance of energy, it turns off its most essential self-cleaning system.
Ah, okay. This is the taking out the trash analogy that Dr. Bosworth uses.
Precisely. She points out that all these common symptoms we feel, the weight around the middle, the brain fog, high blood pressure, they're all just physical signs that the body has. Well, made more trash than it has cleaned up.
And that trash is what exactly? Like actual waste?
It's cellular debris. Old, damaged proteins, inflamed material, the junk left over from normal metabolic processes.
So what's supposed to take that trash out?
It's a process called autophagy. It literally means self-eating.
The body's own cleanup crew.
Exactly. It's the cellular maintenance crew. But here's the catch. It only gets activated when insulin levels drop. Way down.
When the body thinks there's a scarcity of energy.
Yes. That's when it starts recycling old parts for fuel. High insulin acts like a barricade. It hides all this debris, shoves it between your cells, especially in places like the brain. So the trash gets made, but the cleanup crew can't get to it.
And that hidden trash just sits there, causing inflammation for years.
Smoldering systemic inflammation for years or even decades.
Okay, so that's a very clear picture of the problem. If high insulin is the roadblock, then the solution has to be dropping that insulin dramatically.
Yeah, that's the only way.
So how does flipping the metabolic switch to ketosis let the body finally clean house?
Well, the mechanism is, it's non-negotiable. You simply cannot make a ketone, which means you're burning fat for fuel if your insulin is high. You just can't.
The body always goes for the easy fuel first.
Always. And that's sugar. So it has to exhaust all its stored sugar first.
And you're not just talking about the sugar from your last meal floating around.
No. We're talking about the deep reserves. We're talking about glycogen.
The
Dr. Bosworth has this great analogy for it. She calls it packaged sugar, like brown sugar in the back of a drawer. It's stored in your liver and your muscles.
But for someone who's been running on high insulin for years, someone who's insulin resistant, that drawer must be completely overflowing.
It's overflowing, and it's basically locked shut.
So if you've been eating a standard diet your whole life, how long does it actually take to empty that drawer and force your body to flip that switch?
And this is where so many people give up. They quit too soon. She says that for some of her most insulin-resistant patients, even when they're on a super strict keto diet, Less than 20 total grams of carbs a day.
Which is almost nothing.
Almost nothing. It can still take up to 15 days.
15 days, wow.
15 days before they even register their very first ketone.
Yeah.
That just shows you how stubborn those glycogen reserves can be. It proves this is a long game.
That really puts it in perspective. People want results in, 3 days, but they might not have even started the process yet.
Not even close.
So once you finally make that transition, you're running on ketones. How is that different from running on glucose? Is it just more efficient?
It's about efficiency, yes, but it's also about cleanliness. If glucose is a fuel that causes these rapid spikes and generates a lot of waste product, a lot of that trash, then ketones are a cleaner fuel. They have significantly less byproduct. And crucially, burning ketones is what she calls an antioxidant state at the cellular level.
So you're not just taking out the old trash, you're making less new trash in the first place.
Exactly. You're activating the cleanup crew and reducing the mess being made.
And this must have huge implications for the brain, right? For the neurodegenerative diseases we mentioned at the start.
Oh, absolutely. The brain benefits immensely. Ketones can cross the blood-brain barrier really easily, providing this immediate clean fuel for brain cells, even for cells that are struggling with insulin resistance.
The conditions some people are now calling type 3 diabetes.
That's the one. And when you fuel the brain with ketones, you see these incredible improvements in concentration, in sustained energy, in mood control, because you've bypassed that whole glucose bottleneck and you're calming down the inflammation in your brain.
Okay, let's pivot to the practical side of this. If you're listening and you recognize these symptoms in yourself and you want to start reversing this state today, what's the single most important change you can make?
The first, simplest, and most powerful thing is to stop eating so late at night.
That's it. More important than what you eat.
For many people, yes. She really emphasizes that as we get older, the cost of a calorie becomes less about the content and much, much more about the timing.
She has a pretty shocking ratio for this, doesn't she?
She does. She says 1 bite of food after 6.0 is worth 10 bites of food before noon.
10 to 1. That's incredible. But let me push back on that for a second. What if my late night meal is pure fat and protein? A steak, no carbs. Is that still as bad as, say, a donut?
That's a great question, and it's a common misconception because people think only carbs matter for insulin.
Right.
But while protein and fat stimulate insulin way less than carbs, any food consumption triggers some insulin release. And late night eating is so bad because it stimulates insulin production that then churns all through the night.
So even a little bit of insulin is enough to stop that cleanup process.
It's enough to inhibit that crucial overnight autophagy, the cleaning that's supposed to happen while you're in deep sleep. You want the lowest possible insulin state while your body is trying to repair itself.
So it's about giving your whole system, especially your pancreas, a real break overnight.
A complete shutdown. That's how you maximize the time you spend in that low insulin cleaning state.
Okay, besides the timing, let's talk about the physical red flags. The visible warning signs that high insulin is already a problem. What should you be looking for on your own body?
There are 4 really common ones. The first is the most obvious: abdominal girth.
That weight around the middle.
It's the body's #1 priority for fat storage, all directed by insulin. Second, look for skin tags.
Where do those usually show up?
Often in the armpits or any place where skin rubs together. She has this great clinical description for them: a crop of little baby cauliflower.
That's a memorable image.
It is. And she tells her patients with total confidence that they will simply fall off once their insulin is consistently low. They're a direct result of growth factor stimulation from high insulin.
They're a powerful visual sign of what's going on inside. What are the other 2?
The third is what's called acanthosis nigricans. It's a velvety, darker, thicker patch of skin.
Where would you see that?
Usually on the back of the neck or maybe the knuckles. It often just looks like stubborn dirt that won't wash off. But it's actually a pathology caused by high insulin.
And the last one?
The last one surprises a lot of people: hair loss on your toes and lower legs.
On your toes. How is that related to insulin?
It's a sign of advanced resource deprivation. When your body has been in that high insulin state for a very long time, it starts to prioritize. And the tiny blood vessels and hair follicles on your extremities are one of the first things it just neglects. It's a signal the process has been going on for a long, long time.
So once someone sees these signs and starts making changes, what's the long game? Dr. Bosworth has this whole keto continuum. a 12-step process.
Right. The continuum is designed to get people to what she calls consistently keto for life without it being a constant struggle. The first few steps are all about strict carb restriction.
Getting down to that under 20 grams a day to clear out the glycogen.
Exactly. But the real game changer comes with introducing time-restricted eating.
Tell us about those stages.
So stage 5 is where a lot of people start to feel comfortable. That's the 16.8 window, 16 hours of fasting, an 8-hour eating window.
Pretty achievable. Just skip breakfast, basically.
Let's skip breakfast and stop the late-night snacks. From there, you can progress to stage 7, which is the 23.1 window. That's 1 meal a day.
And that must push insulin to a new low.
A new low. It maximizes that autophagy cleanup. And then the later stages bring in periodic prolonged fasts, 36 or even 72 hours, to really give the pancreas a deep reset.
This is so much more than a diet plan. It's a profound shift in how your body handles energy. Let's really drive this home with some of the clinical evidence, the story about the cognitive reversal.
This is one of the most powerful anecdotes she shares. It's about a 40-year-old patient with Down syndrome who also had advanced Alzheimer's.
A population that's known for really severe insulin resistance.
Exactly. So they put her on a very strict, measured ketogenic diet to try and fuel her brain with ketones directly.
And what happened?
It wasn't instant, but it was fundamental. After just 3 weeks, the patient's mother called, just incredibly emotional. She was recounting something that happened at church.
Okay.
The daughter had been asked if she understood some instructions, and the patient replied, "I understand."
Now that sounds simple, but I'm guessing there's more to it.
It was absolutely monumental. "I understand" was the first 3-syllable word that patient had ever spoken in her entire life.
Wow.
This patient, whose brain was just deteriorating from this type 3 diabetes, suddenly had her world and her vocabulary open up. Her brain, newly fueled by ketones, was functioning better than it ever had.
That is it's tangible proof that even a very compromised brain can use this other fuel source and start to heal.
It really is.
You also mentioned she's seen physical signs of rejuvenation like gray hair reversal.
Yes. Which suggests that the actual cellular machinery for hair production is just healthier. It's working in a low inflammation, low trash environment. The body can finally dedicate energy to things that aren't just basic survival.
The ultimate test of this whole idea really came when she had to apply it in her own family. The story of her mother, Grandma Rose.
Right. Grandma Rose had a cancer recurrence and was given a devastating prognosis. About 6 months to live.
And instead of more chemotherapy,
Dr. Bosworth convinced her to try a strict ketogenic diet instead. The goal was to create a hostile internal environment for those tumors. You can imagine the tension.
and the results were just far beyond what anyone expected.
Absolutely astounding. After only 6 weeks, her mother's cancer markers had dropped by 70%.
70%. And what would chemo have done?
The expected successful reduction from the chemotherapy protocol was only 30%. So by just changing the fuel source, they got a vastly better outcome.
That ties right into the Warburg effect, doesn't it? We hear that term, but what does it mean in simple terms?
The Warburg effect is just the observation that cancer cells are addicted to sugar. They prefer to use this rapid sugar fermentation process for energy, even when there's plenty of oxygen around.
They're glucose addicts.
Totally.
Yeah.
So by cutting off their main fuel and replacing it with ketones, you're essentially starving the tumors. And you're creating an environment where your own immune system can fight back more effectively.
It's just profound. It really underscores how much control we have over our own internal landscape.
We really do.
So let's pull all this together for the listener. The core takeaway, the mission to avoid chronic decline, Parkinson's, Alzheimer's, all of it. It all starts with managing insulin.
It really is all about lowering that insulating hormone. And you do that by controlling late-night eating and cutting back on carbs. That's what forces your body to turn on its natural trash removal system autophagy by making ketones.
And as a final note on performance, she mentions that when her patients go off keto, they feel it almost immediately.
Oh, yeah. They describe it as the swelling and inflammation returning to the brain. It feels like a minor concussion.
Wow. And on the flip side, injury repair is faster when you're in ketosis.
Much faster because of that low inflammatory load.
Okay, so here's a final provocative thought for you to explore next. This goes beyond diet. Dr. Bosworth often supplements her own approach with 2 specific compounds for peak brain performance.
Yeah.
Creatine and methylene blue.
And this is where it gets really interesting for mitochondrial health. Because ketones are the clean fuel, but you still need good power plants, your mitochondria, to burn that fuel.
And methylene blue is? It's an old dye, isn't it?
It is used for malaria originally. What's fascinating is that it easily crosses the blood-brain barrier.
She has this amazing detail that when swallowed, it will literally dye the heart and brain blue in an autopsy.
Which is just absolute proof that it gets to those critical energy-hungry organs.
So what does it do there?
It acts as a direct electron donor. It optimizes the whole power production process inside the cell. It's like a turbocharger for your mitochondria. It ensures that those brain cells, which are finally getting clean ketone fuel, can actually use it at peak efficiency.
So it's a powerful tool that works with the metabolic changes, not instead of them.
Exactly. It's a 1-2 punch for cognitive health.
A massive reminder that it's about both the fuel you put in and the efficiency of the engine burning it. Thank you for joining us on this deep dive into the true cost of excess insulin. Now go put this information to work.